Live broadcast. Welcome everybody. Facebook Friday, YouTube Live Friday. So we're just gonna get going here. See as people jump on if anybody has questions. So don't know if anybody's on here yet. I'm just gonna refresh this feed and see who's here. All right, I think we're live. So here we are, Facebook Friday, live again, here to answer your questions. Looks like some folks are jumping on Facebook. We'll see if anybody jumps on YouTube or not. So we're here to answer. I'm here to answer your questions. Don't have a whole lot smart to say until some questions start rolling in. So we'll see if you guys come up with anything here in the next little bit. If you're on here and you can hear me and see me, give me a thumbs up. Let me know you're here, so I know this thing's working. I think it's working. Just gonna go back to YouTube comments for a minute. Hey there, whoever's jumping on YouTube, welcome. If you can hear me and see me, give me a thumbs up or a comment or something so I know you're there. Just going to jump into my comment section here for a minute and see if there's anything interesting to start talking about while you guys are putting your questions in the chat. All right. So here's one that came up not too long ago. And this is something that I see a fair amount. Hey, Kenzie, jumping on there, Facebook. Thanks for giving me a thumbs up. I know you're there. Something that came up pretty recently and comes up frequently in the office is after patients had a miscarriage, when is the best time to start trying again? And forever we've told people, well, you should probably wait some arbitrary period of time. Is it 3 months or 1 month or 6 months or what? And there really wasn't great evidence to tell us what the right answer was until fairly recently. So a study that came out within the last year or two showed that looked at conception rates after miscarriage based on time between the miscarriage and when people started trying. And what it turned out was that this is basically the sooner you started trying, the higher the chances of getting pregnant and staying pregnant. So the recommendation of waiting 3 or 6 months after miscarriage is not good advice anymore. The evidence suggests that pretty much you should start trying right away. So when you have a miscarriage, once that's resolved, so either the bleeding has stopped or if we're following hormone levels, if those quants have resolved, that's the best time to start trying again. So that's just a little piece of advice that is fairly new and people should be aware of. Saw a couple of comments pop up over here on YouTube from Megan. Hey Megan, prostaglandins PMS flu ? Not totally sure what those questions really mean. So if you have a more specific question, put it in the comments. I'll be happy to answer it. Looks like Danielle's jumping on. Fourth pregnancy, having a lot of belly cramps, and from where you've had past epidurals to tailbone, a lot of pain, low back, spasms, 20 weeks. Does that all sound normal? Yeah, so I saw that question. I'll come back to it in a second. The trend that I have found with people, especially working out here in Utah, where people have big families. So when I practiced back east, it was fairly unusual to see anybody have more than a couple kids. It was pretty unusual to see 3 babies. It happened every now and then, but it wasn't very common. But here in Utah, we see folks 3rd, 4th, 5th babies all the time, every day. And the thing that I have determined from about 10 years working here and seeing just multiple moms have 3, 4, 5 kids is, as far as low back pain, lower abdominal pain, things of that nature, it gets worse every time. And so, by your 4th baby to be kind of crampy, lower abdominal pain, low back pain is not at all surprising. So I think that's probably normal. What I tell people is basically watch out for things that could be concerning. So signs of labor. So if you're feeling cramps that are coming and going every 5 minutes for an hour, that's potentially concerning for labor. So I wouldn't ignore that. If you're having bleeding like a period with abdominal pain or fever or other symptoms that sound like something not necessarily pregnancy related but equally bad. So for example, If you have, right lower quadrant pain and fever and nausea, you got to think a little bit about appendicitis. If you're having, upper back pain, high up, sort of almost below your shoulder, below your scapula in the back, shoulder blade, then you got to think a little bit about like kidney stones or gallbladder even, particularly if it's a right upper quadrant. So, but if you're having none of those things and the baby's moving good, it's just normal. So, okay, so let's see, Megan, I was going to look into, yeah, I did. I looked into this, the menstrual flu or menstrual PMS type flu, and there's just no good data on it. There's nothing in Up to Date, which is what I consider, basically one of the best evidence-based resources really on the planet for docs to look at to try to learn about things. And there's nothing more than what I basically told you before, which was that there definitely are people who have altered levels of prostaglandins that do cause more pain and more flu-like symptoms. So things like non-steroidals such as ibuprofen or naproxen are probably your best bet to try to minimize those symptoms. So I didn't have a whole lot more than what I mentioned before, but I did look into it, and that's all I could find. So hopefully it's helpful. Sorry, there's not tons more data out there to really tell us. Okay, let's see. Kinsey, what are the chances or probability of getting pregnant on birth control? It's probably dumbest question you get. No, I get that question all the time. So all methods of birth control have a failure rate, and there are basically two types of failure rates. There's the perfect use failure rate, which means whichever method we're talking about was used exactly as it was supposed to be, versus kind of the practical everyday failure rate. So birth control pill, if you take it perfectly, in other words, same time every day, never missing a pill, no other medications that would interfere like certain antibiotics can, then the pregnancy rate for a birth control pill is less than 1%. And with IUDs and things like that, it's even less than that. It's about 1 in 1,000 or somewhere in that neighborhood. But if you miss a pill, if you miss a couple pills, all bets are off. Certain types of antibiotics can also reduce the effectiveness. There are also certain migraine medications like Topamax can reduce the effectiveness of birth control. So, but assuming none of those, then it's probably, in that 1% or less neighborhood. So let's see, you had a follow-up here. You had son in July, haven't had a period, minus bleeding after son, could be something else. Well, if you're nursing, it could just be from that. So nursing suppresses ovulation. And so a lot of people who nurse or even just pump and feed the breast milk to the baby but don't feed by formula will not have a period for pretty much that whole time. So you have elevated levels of prolactin, and prolactin's what makes you have breast milk, but it also suppresses ovulation. So that's kind of nature's birth control. So it could be either or both of those things. So probably if you haven't missed any pills, if you feel worried, you could check a pregnancy test, but I wouldn't be too worried about it personally. Okay, saw something pop up over here on YouTube. Let's see. Trying to conceive, periods are irregular. So the Lemus family. There's a really detailed video on my YouTube channel, which you already know about because you're watching me on YouTube, under the category of infertility / trying to conceive. It kind of runs through the majority of stuff you'd need to know between two videos. One is the PCOS video, and the other is, I just put a video up recently about how I dose Clomid or Femara. Hey, Didi, how's it going? Those would be the ones that I would look at that sort of describe in detail, not only, and also there's one about evaluation of infertility. So I would look at those three videos. It talks about it in detail. But basically the gist of it is, if you're not having regular periods, you're probably not ovulating regularly. The two typical hormonal things we think about, hypothyroidism and hyperprolactinemia. So we do blood levels on both of those. If they're normal, then a lot of people fall into the PCOS category, and that's where that video kicks in that I was mentioning a second ago. Mostly the big things you can do on your own are lifestyle modifications, so diet, exercise, trying to lose a little bit of weight. For people in those situations, it does help. And then secondly, ovulation induction with either Clomid or Femara, and I'll walk through all the steps of that in that video, so maybe check those out. All right, let's see. Allie says, are there meds that can be taken while nursing for ADHD, if only nursing at night? I don't know about nursing, a little bit or a lot. It's probably the same question regardless. And the short answer is going to be, we don't know. There's going to be a little bit of almost any medication that gets in the breast milk. You don't know what the long-term effects are on the developing brain of a baby by taking stimulants while you're nursing. So my advice would be don't take it. It's, ADHD. My wife has ADHD, so I know a fair amount about what that life is like. But I just would say it's just not worth it when you're nursing, because we just don't know. We just don't know how much really gets in the breast milk, and to what extent would that affect the baby. Obviously, their brains are developing very rapidly. They're forming all kinds of neural connections and things like that. So you just don't want to interfere with that. You only get one shot for your baby's brain development. So I'd play it safe and not take it. Let's see, I saw something pop up over here on YouTube. Let's just see what that was. Sorry, is it gonna work? There we go. Oh, thanks, Love Channel. Thank you very much. All right, cool. So let's see, Kristen says, had one child, considering another. Hubby's 45, she's 37. Some higher risk are the things you can do to help the conception. So, a lot of the sort of things you can do when it comes to getting pregnant, say over 35, are really the same things that you would do under 35. So, all of the obvious in terms of lifestyle things, being a healthy weight for your height, getting regular activity, having a healthy diet, avoiding basically any and all medications to play it safe, with the exception of like a prenatal vitamin, some vitamin D, things like that, are really kind of where I would start. And then in terms of like, what are the specific considerations for someone over 35? Two things. One, conception rate's a little lower, but plenty of folks are still getting pregnant, so I'm not saying you can't. But it could be a little harder. Paternal age really doesn't play too hard of a role until it gets above 50, so I'm not too worried about the husband at 45, assuming he's otherwise healthy. But for moms over 35 who get pregnant, a little higher risk for things like Down syndrome and other chromosomal abnormalities. So there is, I'm going to keep plugging this YouTube channel. There's a whole video on that exact question, that exact topic on my YouTube channel. I'm just going to plug it over here on Facebook. Wes D. Ski is the name of it. So if you go to YouTube and punch in Wes D. Ski, you'll find my channel. There's a video called, is 35 too old to get pregnant? The answer is no, it's not. But I kind of walk through some of the things that I'm telling you about now. And then also in the infertility / trying to conceive playlist, there are 2 or 3 videos I'd look at. One is about how to maximize your natural fertility. It's some simple things you can do in terms of timing of intercourse. Certain types of lubrications are better than others. How to monitor for ovulation. All those things are covered in that video. There's another video on there about pesticides. So basically going organic is definitely better than non-organic fruits and vegetables. There's a study out of Harvard that showed proof that the residual pesticides on conventional fruits and vegetables probably do, I should say proof than probably, but there's an association between consumption of conventionally grown fruits and vegetables and lower fertility. So going organic would appear to be the better way to go. So I would definitely look at those. There's one on there about foods to avoid during while trying to get pregnant or during pregnancy, and mostly it's all about avoiding fast foods. So I would look at all those. That pretty much covers all your bases, and really anybody who's trying to get pregnant. Most of those are worth looking at, and if you're over 35, then the 35 too old to get pregnant video is just for you. And of course the answer is no, it's not. It's just a catchy video name. All right, so let's see. I saw something pop up over here on YouTube. Let's see. Hello from Chicago. Awesome. Let's see. 6 months, not pregnant. Could it be you're not ovulating? Signs of ovulation. So I was just plugging this video that's on the channel you're watching right now that talks about maximizing your natural fertility. And a big chunk of that video talks about ovulation monitoring, either with ovulation predictor kits or cervical mucus. So I would look at those as a potential way to try to see if you're ovulating or not and the timing of that. One quick and dirty way to say are you ovulating or not is if you're having regular periods. So, if you're having a 28 to 30 day cycle and you have typical premenstrual symptoms before your period starts, you can pretty well count on the fact that you're ovulating. So that's an easy way, but maybe look at that video in terms of how to look with ovulation kits and also cervical mucus to sort of monitor for signs of ovulation. It turns out cervical mucus really is the best way to predict ovulation, and it's free. So so regular periods, some sore breasts during periods, Yeah, so that it sounds like probably ovulatory. 34 days is getting a little bit long, but still probably fine. So you may look at some of the same videos I was just talking about a second ago in terms of maximizing your fertility and sort of foods to avoid, things like that. That's all evidence-based information. I go through the studies in detail where the data was available to really kind of explain where we're getting this info from. So I would check those out, and I wish you good luck in Chicago. Let's see. Haley says, lost a lot of hair, a lot of hair. Acne by her hairline, not sleeping, weight gain, no motivation, tired a lot, think it's stress or hormone problem. Um, so this is like a super common question. So thanks for asking it, Haley. Every single day I'm in the office seeing patients, I get this question. And it's some variation, but a lot of the same symptoms. Often fatigue and weight gain and sort of, acne or changes in facial hair or changes in the hair on your scalp. And do you think this is hormones, and what do you do about it? And it is a tough one to crack, I will tell you. Um, the main one, the main sort of hormone we know can be associated with fatigue, of course, is thyroid. So anybody with the symptoms you're having should have their thyroid tested. You should probably get tested for you should probably do some, I won't say get tested for polycystic ovarian syndrome because there's really not a test for it, but there's some blood work that's kind of circumstantial evidence. So for example, look at your testosterone level, you can look at your insulin level. I would do some basic screening like that. Maybe looking at like serum chemistries, make sure kidney function, liver function, stuff like that's all normal. Because those are all things that if any of those things were out of whack could cause a lot or all of your symptoms. So that's where I would start. Now, a lot of people, you check all those things and basically everything's normal, or maybe you find like you're suspicious the patient has PCOS, and what do you do about that? Some people get some relief from some of the symptoms. Some people get some relief from some symptoms. PCOS with metformin, it's not the greatest medication in the world to help get pregnant, but there's some evidence that it lowers insulin levels. It may correct some of the other metabolic derangements that occur with PCOS, and it may help with some of the symptoms you're describing. So not wrong to think about that, assuming either physical exam, blood work sort of confirmed my suspicion there. So if that was the case, I'd think about that. And then another one is kind of once you've checked everything, if everything's normal, now what? That's a hard one, but that's where lifestyle change is really probably the biggest key. It's so hard to tell somebody, well, go exercise, and then you'll sleep better and you won't be so tired because you're like, oh, I'm already tired. How am I supposed to exercise? But really, truly, a lot of things can get reset in your body with regular physical activity. And I'm talking like aerobic, obviously. I'm not talking about lifting weights, although lifting weights are great. But doing some light cardio every day, particularly outside, getting some sun exposure, trying to get your body clock reset, all those things really do matter and really do help. And there's all kinds of research that backs up those things, and I'm telling you, I'm not just pulling that out of the air. So I would start with a lab evaluation and then consider some lifestyle changes. I like this guy Laird Hamilton. I don't know if anybody knows who he is. He's a crazy world famous surfer, extreme athlete kind of dude. But he's also kind of gotten into nutrition and wellness in his older years. He's a little bit older than me, but not by much. And he's having a lot of the same aches and pains that old guys like me get, and talking about what you can do to try to combat some of those things. He's, like I am, a big proponent of a lot of physical activity. My goal, and I never really put into words, but he did so well. Talked about this idea of just like at the end of the day, you've exercised so much that like you just fall into bed and fall asleep, and there's something to that. There's something to that level of physical activity every day. I pretty much exercise every day. If I don't, it's a bad day. So that's a big part of what I believe has helped me personally with my own health and wellness. The downside is, orthopedic stuff starts to happen, so you start wearing out your knees and hips, which I'm kind of battling with now. But at any rate, that regular physical activity to me is kind of the linchpin of everything. And so I would definitely consider looking at that as well, Haley. Okay, so let's see. Something jumped up over here on YouTube from Didi. Let's see. Didi was talking about her ovulation was probably a little bit less frequent, and I agree with that. Hair shedding after pregnancy, how long is that normal? It can go like 6 or 12 months. So there's this thing that happens when you're pregnant where the hair follicles kind of go into a state of suspended animation. They pause in this phase called anagen, I think it is, and the hair follicles just kind of hang out, and the hair just grows. And then it's related to the hormonal effects of pregnancy. And then when you have the baby and the hormone things all crash, then you get this thing called telogen effluvium. So the hair follicles switch over to the telogen phase, which is when they shed. And so the hair follicle's still there, but the hair shaft itself is gone. And so people lose hair like gangbusters when they're postpartum, and it can go for months. I've even seen folks a year down the road. So it's not at all uncommon. It's typically not something that's permanent. If you're getting beyond that 6 or 12 month neighborhood, then it probably is not just TE. We call that telogen effluvium anymore. And at that point, maybe doing something like a scalp biopsy. So dermatologists can do that. They just take a little bit of your scalp, and they can look and see if there's some sort of weird inflammation going on. Is there some kind of strange autoimmune thing happening? Although I think most of the time they're probably normal, but that's what you typically do as sort of the next step. You can check thyroid levels. Thyroid is like everywhere. Check thyroid levels. Some people who are iron deficient lose more hair, so checking your iron reserves with a ferritin level can sometimes be helpful. Most people are not going to be so iron deficient that's why they're losing hair, but those are all things that I would think about. So let's see. Amber, can Latisse help stimulate eyelash growth be used during pregnancy? Good question, and like a lot of meds in pregnancy, the short answer is, everybody with me? We don't know. We don't know. It's a new drug. There's no tests. There's been no studies of that medicine in pregnancy. There might be a pregnancy registry. I'm not aware of it if it exists. Where some of the new drugs, basically, when they come out, they'll have a website where if you get pregnant, you can register and say, "Hey, I'm pregnant." If anything happens, kind of let them know. But that's where it is. So Latisse is new. We just don't know. It's topical, so you would think it probably wouldn't have, very much effect. It probably doesn't get absorbed into your bloodstream to any appreciable extent. So I doubt that it's any major problem. But doubting something and knowing something are different things. And again, we just don't know. Let's see. Haley says, thanks, Chad. Everything checked except hormones and ovary stuff, thyroid, everything else is great. So yeah, okay, cool. Well, best of luck getting to the bottom of all that. So let's see. I think I managed to get caught up. And I say this every time, but if you put a comment and I haven't answered your question, it's because I can't see it. Every now and then, some comment just doesn't pop up on my screen. So if you have not gotten an answer, I'm not ignoring you. I just don't know that you have a question. So copy it, paste it again, and let me have a chance to answer it. So I think I'm caught up on Facebook here. So Dee Dee was talking about some hair loss, and she's about 7 months postpartum. So yeah, it's gosh, has it really been 7 months, Dee Dee? That's crazy. Yeah, I think you're probably still in the normal range, and I wouldn't be too worried about it just yet. All right, I'm caught up. So you guys, if you have questions, put them in the chats, and I'll be happy to answer them. Gonna take a water break. Oh, and I'm wearing my New York Marathon shirt today, if anybody cares. Getting ready for the New York Marathon. It's in a month. It's a month from, well, gosh, no, it's like 3 weeks from now. Holy cow. I think it's 3 weeks from tomorrow. It's the first Sunday in November. So I've been doing these long runs, and like I mentioned before, fighting this knee pain. This is so much fun getting old. So I've had to take a little break from running, and I'm just biking and swimming. I hope my knee comes back around so I can run. I'll probably make a video of that again. That was fun last year, making the New York Marathon video. I'll probably do one of those again. Let's see. Hey, Cheyenne says, boyfriend had his last child 11 years ago. He's 33. Been having a hard time getting pregnant. Hadn't had a child. I don't think it's anything to do with the period of time between conceptions. So, but the only thing I'd say is it's been 11 years since he got anybody pregnant. So, things could certainly change in his health that could lead to difficulties getting pregnant, just in general, nothing specific to the period of time that has passed. So never wrong, to do just a basic evaluation. Really, for any couple who's having a hard time getting pregnant, the top three things you're going to think about are sperm, ovulation, and tubes. So sperms are up there. So semen analysis is a really simple test. Through our office, we can get him referred to one of the local fertility clinics, and they can do it there. And basically, in a day, if everything's okay or not. So I would definitely look at that. And then the ovulation question we sort of talked about earlier. How to know: are you having regular periods? Do you have some premenstrual symptoms before your period starts? And is the cycle length something reasonable, 28 to 35 days? If those things are true, then you're probably ovulating. And then the tube question, is only one way to find that one out. That's the hysterosalpingogram, which is an x-ray, not a very fun x-ray, but a very valuable piece of information. So I say very fun because it's kind of painful. So, shoot some contrast dye up your cervix and watch it fill the uterus and spill out the tubes, and that's how you know if the tubes are blocked or not. So those would be the kind of things I'd think about for someone if, say they've been trying for a year or longer and haven't gotten pregnant. So, and there is a video on my YouTube channel about that kind of goes into some detail. All right. So welcome to everybody just jumping on. If you have questions, feel free to put them in the chat. Thanks to everybody on Facebook and YouTube. I'm doing a dueling live stream today. I tried to get as many people on the stream as possible. So thanks to everybody who's watching. And I think I'm all caught up on YouTube. Yep. And it looks like I'm all caught up on Facebook. So, okay, guys, take me out. If you have a question, put it in the chat. And tell me, too, I'm just curious. I know where Dee Dee's watching from. But for anybody else who's watching, where are you watching from? I saw Chicago earlier, that might be the furthest away. We'll see. One time I had somebody watching from Guam, which I had to look up on a map where Guam was. It was way the heck out there. So we'll see if anybody's further away today than Texas or Chicago. Just tell me where you are watching from in the chat. Okay, just waiting for some more questions. I'm all caught up, so I'll see what you guys put up next. So we'll jump back on my YouTube channel for the comment section and see what else is interesting to talk about. There's always questions about people who are interested in trying to have a vaginal birth after C-section, which probably most of you know. I'm a huge proponent. I personally have had a lot of success and very minimal on the complication side of things over the years. So there's always comments in my YouTube channel about, this was the scenario that I had that led to my C-section. What do you think about my chances of a successful VBAC? And it's like my responses are always the same. So there's a video on the channel. It's called Vaginal Birth After C-Section. You can do it. And there's a link on that video description that that you can take. That it takes to a website that's run by the Maternal Fetal Medicine Units Network, and it will calculate for you your chances of success. And it's a well-designed calculator. It was a huge study. They looked at thousands of women to develop the calculator. They validated it on thousands of other women, so it seems to be predictive. And basically, you put in your own information and things like your height, your weight, your ethnicity, the circumstances of the C-section. Have you ever had a vaginal birth? Have you had a vaginal birth after your C-section? All those things, and it'll basically spit out a number and tell you what your chances are. And basically, my advice is if you can hit 60% or better, then I would encourage someone to try. And that's true after 1 or 2 C-sections. I haven't done any after 3, but definitely after 1 or 2, we're good to go. So the point to that whole tirade was that if you have those questions, that's the place to go. Get on there, hit the calculator, figure out your chances, and that'll tell you. And it talks about it more in detail in the video. What the heck is going on? All right. Sorry. Looks like everything's still working. My stream was acting weird there for a second. Stay on page. Someone trying to take over my stream here. Let's see. Okay. So Cheyenne says, sorry, I'm just trying to fix this stream here. I think we're okay. Periods are 22 days apart, only going 3-4 days. So pretty short cycles. You know, a lot of cramping. Doesn't sound entirely normal. And the mucus thing, it's really more about the change in the consistency of the mucus. And I describe it in a lot of detail in that video on the maximizing your fertility. Sorry, this thing is just acting weird. Let me just refresh it and see. Okay, I don't know. Seems like it's still working. If you guys can still see me and hear me out there, just give me a thumbs up or something. My stream is acting weird, but it seems like everything's working. So let's see. I think I saw a comment pop up on YouTube over here. South Africa, holy cow, that is crazy. Welcome. Is it Shani? Shani? That's amazing. South Africa, that is crazy. How often do babies get stuck during childbirth? Why would that happen? That's a big, broad question. But the short answer is I used to kind of think about like what we call like the 4 P's. So the passenger, so the baby, which could mean the baby's size, or the next P, which is the position. So if the head is in some kind of weird position, then that can also lead to obstructed labor. The power, which can be the power of the uterus, so how hard is the uterus contracting, or the power of pushing, for example. And then finally the passageway, so the pelvis, essentially, you know, the shape and the size of the pelvis are things that any or all of those things can affect your chances for vaginal delivery. Most of them are really hard to figure out ahead of time, but when you're asking like why or how, those are kind of the hows. So that's the short answer. I think I'm still working. This thing's acting really weird. Okay, let's see. I think I saw another question pop over here. Let's see. What if you scored a 35%? Should you just forget about it? That's a little discouraging. I mean, here's the thing. If you look at your risk versus benefits when you think about a vaginal birth after C-section, 60% is arbitrary. It's what our college recommended, basically because it's better than 50-50 is one thing. And secondly, it is considering, well, what happens if you don't succeed? And so if you look at sort of the order of preferred or the order of complication risk, right? So it's lowest if you have a successful VBAC. Not too far after that is a planned, scheduled, unlabored C-section. The worst one is a failed trial of labor after C-section that leads to emergency repeat C-section. So people in those situations have the highest risk of complications. So so that's where I think it's useful to at least know what the chances are in this situation where you're trying to have a vaginal birth. So 35% is pretty darn low. And so you flip that around and say, well, so that means it's like 65% chance it's not going to work. And so it's more likely than not that it's not going to work, which means you're taking these additional risks for not much benefit. So to me, 35 is low. I mean, I would never tell anybody you can't do it, but I would just say, hey, you need to be aware of this. So that's why I think that is useful. So let's see. Quick question over here on Facebook was, what's the biggest baby I've delivered? 13 pounds. 13 pounds. It was a C-section, thank goodness. The biggest vaginal delivery was like 11.4 a couple years ago. Let's see some other stuff popped up over here. Hello Sisters. Which app or device would you recommend to check ovulation cycle? I really personally have not messed around with a lot of the different apps. I know there's a million of them. I mean, they all pretty much do the same thing. You can do things like basal body temperature. You can track your cervical mucus, and so and then they look at those things. They if you get certain ones, you can add, ovulation testing. Some of the apps will predict it for you kind of proactively. So based on your cycles, this is what you think it's going to be. It's not exact. Dee Dee was saying she used an app called Kindera and Ovia. Dee Dee always knows the answer. If I don't know the answer, just ask Dee Dee. She always knows. But you know, any of these are fine. They're all kind of doing the same thing. They're all tracking these sort of known things. Um, let's see. What's opinion on estrogen dominance for fertility? No good data that I'm aware of. The this does not apply at all to somebody who's doing you know, ovulation induction with injectable fertility drugs or with in vitro. This is not at all what I'm talking about. I don't know much of anything about that. But in the sort of spontaneous ovulation or ovulation induction with Clomid or Femera, there's just no good data at all that you can look at like estrogen to progesterone ratios to say, you know, you're good or bad. So and spontaneous conception, there's just no good data. And in fact, there's a video on my YouTube channel that talks about this. It was more looking at like AMH levels, so anti-Mullerian hormone levels, inhibin levels, FSH. It was very in vogue for many years to check those to say, oh, well, based on these levels, you know, you have a 100% chance of getting pregnant or 0% chance or, you know, whatever in between. And it was extrapolated from in vitro data. And it really turns out it's been restudied in the spontaneous conception, and it doesn't predict it at all. So I have a suspicion that like estrogen dominance is probably in that same category. There's just good data that would tell us one way or the other. So I mean, you can look at age, and age is a predictor. But in 43s, you know, people get pregnant at 43, but it's definitely harder. Definitely higher chance of miscarriage, definitely higher chance of chromosomal abnormalities. So, you know, it's still possible, but definitely harder. And the trickier part beyond that is that there's no good test that we can really do to tell you, well, how good's it looking, at least in spontaneous conception. Now, different story if you're talking about in vitro. On Facebook, if you guys are still there, I still see some people watching. Give me a thumbs up or a smiley face or something so I'll know this stream is still working. I think it is. I'm just getting weird error messages on my page, so I'm not 100% sure that it's working. But it looks like folks are still watching, so if you hit a little, I'll see like a little happy button there, then I know that you're watching and it's working, so let me know. I'm not seeing any questions popping up on Facebook, so I'm wondering. Oh, I'm seeing a couple of thumbs up go by, so somebody can see me. Yay, thanks. Let's see. I think I'm all caught up on questions over here on YouTube too. So, okay, hey, I got a question. Jenica, migraines got worse during pregnancy. What causes them to get worse during pregnancy? Great question. Probably estrogen, if I had to guess. You know, we know that the blood vessels to your brain are very sensitive to estrogen. Most people who get, and thank you guys who are doing the thumbs up, so I'm encouraged, it's still working, thank you. So, you know, you make a ton more estrogen and progesterone for that matter when you're pregnant. And probably that is affecting the degree of vasodilation of blood vessels that go to your brain. And that's thought to be a trigger for migraines. So it's probably something like that. The other part is that we know your cardiac output goes up just in general. Your heart is pumping more blood throughout your body, so there's just more of it, you know, banging up against your brain too. So it's probably all the above. My tips to anybody who's pregnant having headaches are real basic and simple. Things we know can make it worse include dehydration and starvation. So small frequent snacks and staying hydrated really push the fluids. A little bit of Tylenol is fine, a little bit of caffeine's fine. I wouldn't drink large amounts of caffeine because there is evidence that it is associated with risk for childhood obesity, which is nuts, but it's been pretty well established. There, much anything over about 50 milligrams a day of caffeine can increase a child's risk of obesity later in life. It's been studied out to age 8, I think it was. So long-lasting effects of, you know, even just kind of moderate doses of caffeine apparently. So probably best question or best answer is to avoid it entirely or minimize it maybe under 50 milligrams a day. Let's see. Something popped up. Personal, if you don't mind. How many children? I have one kid. He's 16. He thinks he knows everything. It's super fun. He's a great kid. But one's plenty. One's plenty for me. Um, let's see. I saw something from Toronto. Awesome. Okay, which is further, Toronto or South Africa? Let me see. I think South Africa, but Toronto's out there. Let's see. Cycle lengths you're talking about here, 23 to 30 days, never the same month to month. Said you worry about chances. Well, I think that what it can mean is that it can make it harder to track because you're just sort of all over the place with your day of ovulation. And so to, sort of maximize fertility, what you want to be doing is having intercourse in the 3, 4, 5 days leading up to ovulation. And so if you don't always know when that is, it makes it harder. But obviously it has worked. You've got a couple children already, so we know the system works, so that's good. Ovulation predictor tests in your case might be helpful. Considering your cycle length, let me see what it was in the shortest, 23 days. So typically that means you're ovulating on those cycles around, day 9, so super early. That it just could make life more difficult, make it more difficult to get pregnant. Didi said I missed a couple. Let me see if I can find them. I don't see them. Okay, so if you're on here and I missed your question on YouTube, please repost it because I don't see it. They don't always come up for some reason in the chat. But so if you had a question and I didn't answer it, copy it, paste it right back in there. It should pop up, hopefully. Okay, here we got one over here. Period talk. I like it. Is it normal? That could be the name of this chat. Period talk. Is it normal to spot a day or two, then have nothing for a couple days, then start bleeding heavily? Yeah, I mean, everybody's exact pattern of bleeding is different. Some folks do exactly what you're talking about. It's kind of hit or miss for a couple days, and then it comes on for real. Other people, it's just full on from day one. Everybody's different. And so I think really the answer is it's normal if it's normal for you. So if this is what your cycle is always like, then I don't have any worry that it's abnormal. Now, if it was a dramatic change from prior, then you got to wonder a little bit about what's going on. But if this is like what you always do, then I wouldn't sweat it at all. All right. So let's see. Cheyenne says, been off birth control for about 2 months. Could that still be making your periods off? No. There's actually a video on my channel that talks about that. This is pretty well established. That there's no delayed return of fertility on birth control pills. Really, the only method of birth control can mess with your ovulation like that is Depo-Provera, and it is well established. Depo can really mess up your cycles for a long time. Like my wife used it back in the day, and when she stopped using Depo, she didn't have a period for a year. So it can really suppress ovulation for a long time. But birth control pills really should not. So I don't think that's what's making your periods be off. So it's probably more a question of ovulation. And like I mentioned before, there's ways to track for that. And if you're getting weird results, then my advice would be, get evaluated. Let's do some lab work, ultrasound, kind of see what's going on. Let's see, something popped up over here on YouTube. Could that pattern starting, stopping, change with age? Yeah, I think it could. So I think, it may be it's a certain way and then it changes as you go through life. Yeah, absolutely. And I think it's sort of like, well, is it the new normal? So if it's what you're like now for months and months, then probably it's the new normal. Let's see what else we got here. Carissa, if trying to conceive, trying to track your period, do you count the spotting day or the heavy bleeding? That's a good question. I usually say, whenever bleeding starts, whether it's light or not, I just start counting. There's no definitive right answer on this, but just for consistency's sake, that's what I would do. And then you can look at other indicators, like I was talking about before, sort of mucus or ovulation predictor tests to help try to hone in on when that's happening. But really the big thing to know is that when you're trying to conceive, you shouldn't focus everything on the day of ovulation. It's really the days leading up to ovulation that are your most fertile window. So not to wait, I got them both, thanks. Not to wait until the day you're ovulating to try to get pregnant. It's really those several days leading up that is your most fertile window. So if you miss it by a day, it's not a big deal, particularly if you have covered the last several days. And I'll talk about that more in my video about maximizing your natural fertility. So if you're curious, you can check that out on my YouTube channel. which everybody over here already knows because they're watching me on YouTube. But you might not know if you're watching me on Facebook, so I'll plug it one more time. West D Ski is the channel name. Let's see. I think I missed one. What's your opinion on riding your horse when you're pregnant? At a walk, nothing more. I get this. This is a very popular Utah question, and it may be popular in other places like Texas and who knows where else. But people ride horses around here, and what do you think about that? I actually, know people who did barrel racing, which I recommend they not do, because obviously that's a high risk sport from a fall perspective. So what I usually tell people is this: there is a chance, no matter how mellow or how well behaved your horse is, that it could throw you. And if you get thrown from your horse and you're over about 20 weeks pregnant, there's a real risk of complications from placental abruption. So you just have to keep that in mind. And if it's one of those like varying degrees of risks and how much risk are you willing to take. And if you've got the best horse in the world that's never misbehaved a day in its life and is super mellow and you're not worried one bit about that, then I think a mellow ride on a horse is no big deal. But if you say, every now and then my horse is throwing me, I wouldn't get on it pregnant, especially after 20 weeks. So let's see. A little follow-up question here. Took a Plan B a month ago. Does that mess anything up? Yeah, it could mess you up for a month or so, Sean. So Plan B can definitely throw your period for a month or so. But I would think, within 1 to 2 cycles after that, you should be good. The main thing to keep in mind is that it's not 100% effective at preventing pregnancy. So if you haven't had a period, check a pregnancy test. Because you're trying to get pregnant and you might even already be. So good luck. Okay, let's see. What test do you recommend after a single miscarriage before trying again? If there's only been one miscarriage, I recommend no testing, none. Because 1/3 of all pregnancies result in a miscarriage, and there's just no need to evaluate everybody when it's something that common. Now, 2 in a row is where I typically start to recommend, so I'll answer it as if it was 2 in a row because that's where I would do an evaluation. The big one is this thing called antiphospholipid antibody syndrome. So it's a mouthful. It's sort of an autoimmune type thing. There's a panel that you can do. It's anticardiolipin IgG, IgM, and the lupus anticoagulant. Those are the labs specifically that you need to check. If any of those are positive, you repeat it 12 weeks later, and if you get a repeat positive, then that diagnosis is confirmed. If you get a single positive and retest in 12 weeks and it's negative, then you have not made the diagnosis. But if you make the diagnosis, then you go down a pathway of treating that person. And for that, we use low-dose aspirin and heparin. And it's been shown to be effective in that specific situation. It's low-dose aspirin, heparin, either or both, a combination or not, are not effective in any other scenario for pregnancy loss. But in this antiphospholipid antibody syndrome situation, it is. So that's why we test. Another thing you look at is called hysterosalpingogram, or a saline infusion ultrasound, or a hysteroscopy, where you look in the cavity of the uterus, and that is to rule out uterine abnormalities. So uterine didelphys, uterine septums, things where the uterus is shaped weird, because they can lead to recurrent miscarriage. So those are the two that you check just kind of like right off the bat. Another thing to consider on a second miscarriage, if you have tissue, you can submit for DNA testing. You can do that. There are certain types of chromosomal abnormalities that are repetitive. Sorry, I just thumped the microphone if you're listening on Facebook. So repetitive miscarriages can be related to chromosomal abnormalities that are actually derived from a mom or a dad. So they're called balanced translocations, and they're present in about 4% of the general population. So that's something to think about. If you take the products of conception and there's none of these translocations detected, then it's not that, and there's no point testing the parents. If you don't have genetic material, if you don't have material from a miscarriage, you can test mom and dad. It's just more expensive because you're testing 2 people instead of one tissue sample. But that's out there, and those are the kind of things you think about just off the go. I always check people's thyroid, because if your thyroid's out of whack, like in a lot of other scenarios, thyroid could mess with things. There's no evidence for checking like progesterone levels. There's no evidence that progesterone supplementation reduces the risk of miscarriage, although we have all done it, me included. There's no proof that it works. So that's kind of your basic. Once you go through all that, and there's a lot of people who fit that category, you test everything, everything's normal, but they've had several miscarriages. What's going on? It's probably there's a decent chance that they have what are called microdeletions in their DNA, which you cannot detect on sort of standard chromosomal testing, but you can with more specific tests. It's expensive and not many folks do it. So a lot of folks at that point go to just go to in vitro. And the idea is, well, if you make 10 embryos and half of them don't make it, you select one of the ones that's healthy, put that one back, and you sort of get around whatever the repetitive problem is. So that's out there too. So that's kind of the quick and dirty on recurrent miscarriage. There is a video on my channel that talks about it in some more detail. It explains that translocation thing a little better. So if you're curious, check that out. Let's see. Danielle says, cousin was recently in a minor car accident, sent to the hospital, 4 hours monitoring, which brings to the question, should you be using the lap seat when you're pregnant? Yes. You should absolutely use your seatbelt worn in the normal way. You could take the shoulder part and get it above the bump if there's a bump there from the baby, so it's not like straight across your belly. But you absolutely need the diagonal part as well as the lap part to properly be restrained in a car. So definitely wear your seatbelt, because the much more likely thing to happen is you die from the car accident because you were not properly restrained or have big injury from being improperly restrained than from the seatbelt itself. So absolutely, everybody wear your seatbelt. Oh, and hey, while we're on there, everybody get a flu shot. If you're a patient of ours, we just got them in yesterday. I think we probably vaccinated like 50 people yesterday in the office. So if you haven't gotten your flu shot yet, come get it. If you're pregnant, we can give it to you. If you're not pregnant, we can't give it to you because we don't have enough for everybody. But if you're pregnant and you're our patient, come get a flu shot. You can get it at your next visit, or you can walk in and get it. Just don't tell them I said you could walk in and get it, but you can. It's fine. Let's see, Cheyenne. Question for a friend: can you run on treadmill and use ellipticals? Yeah, absolutely. And tell your friend, there's a video on my YouTube channel called Exercise in Pregnancy, and it goes through this in detail. The gist of it is that moderate cardio is a good thing. There's all kinds of evidence of benefit in pregnancy. Absolutely everyone who's pregnant that is physically able, with a few rare exceptions like preeclampsia or you're dilated 5 centimeters and you're 28 weeks. But if you're just a normal pregnant person, no complications, 30 minutes of cardio per day, 5-6 days a week, absolutely is a really good thing to do. It's going to help you have a healthier weight gain for your pregnancy, and that's important in terms of reducing your C-section risk. It's probably the number one thing you can do to reduce your C-section risk is not gain excessive amounts of weight. And how do you do that? Stay physically active. Absolutely, my friend, it's okay to use treadmill, elliptical, bikes, and stuff like that. Outdoor activity, a little bit of risk for falls. So, riding a bike when you're 38 weeks pregnant might not be the best idea outdoors, just because, well, what if you crash? But, otherwise, even continuing to run all the way till you have a baby, if it hurt too bad, it's perfectly fine. So I encourage folks to stay active. Let's see. Can hypothyroidism cause recurrent miscarriage between 4 and 5 weeks? Answer, maybe. We test for it. If someone is out of whack on the thyroid, we treat it. It's not entirely clear, but it's definitely reasonable to treat thyroid if you have recurrent miscarriage. It's important to treat thyroid if you don't, just because, having appropriate levels of thyroid hormone when you're pregnant are important for brain development for babies. So it's just good all around. Let's see. Hello Sisters has beta thal minor. Should you be doing anything before getting pregnant apart from getting my parents for beta thal? From getting my parents. Okay. Well, the first part of your question is, should you do anything before getting pregnant? Nah. I mean, beta thal minor is not that big of a deal. There's some evidence for higher risk of urinary tract infections for some reason in people with beta thal. You'd want to make sure you're not anemic, and work with your hematologist or your family doc if you are, to get a nice normal hemoglobin level prior to pregnancy. But aside from that, no, nothing specific. Most folks with beta thal minor do just fine. I've had a bunch over the years. Even like sickle cell trait in African American people is not that big of a deal. Now, sickle cell disease is a big deal in pregnancy. It's someone who's considering pregnancy who has sickle cell disease would be very high risk for complications in pregnancy, and I would definitely manage that person with a high risk specialist in helping us out for sure. But beta thal minor, no big deal. Cool. I think I'm caught up. Okay. Oh my gosh, I've been going for 56 minutes. That's crazy. So we'll wrap this up in about 5 minutes. But if you have a question, it's been kind of quiet over here on Facebook. YouTube's been lighting it up. If you guys have any last minute questions, hit me up, and we will be happy to answer them. Otherwise, we'll wrap this up here in a couple minutes. Can you take over-the-counter sleep meds while pregnant? Yeah. So like Unisom is fine. Unisom you could take every day of pregnancy. It won't hurt a thing. And then and in fact, there's evidence that Unisom in pregnancy reduces nausea. So it's one of the things we use in people who are pregnant, say first trimester, second trimester nausea. So Unisom's totally fine. Let's see. Is it normal to have 30 days between miscarriage and next cycle? Yeah, that's about right. So that sounds pretty normal. Usually within a month or so you'll have a period. So, excuse me, I think you sound like you're very normal. All right. Let's see, tips on easing back pain while pregnant. That's a good one. If you're in the office, grab a handout. I've got some exercises and stretches you can do. It's mostly about your core and your alignment. Those are the big two things that get out of whack when you're pregnant. So all the stretches and everything are aimed at those things, strengthening your core and improving your alignment. Because when you're pregnant, what tends to happen is your low back tends to kind of arch out. So normally if your spine's like this, what you get is that. So you get a lordosis. And that puts pressure on your low back and it hurts. So trying to correct that lordosis, like your sacroiliac joints also can get rotated and get freaky and painful. And so there's some sort of rotational exercises to get those back into alignment. Physical therapy is also useful in those situations if it's bad. I'm not able to really demonstrate those exercises very well on this camera here, but swing by the office, grab a handout, and check it out. Or you could probably Google it. If you Google ACOG, so ACOG, that's the American College of Obstetrics and Gynecology, ACOG back pain in pregnancy, that's where I got my handout from. So you can probably Google it online and print it out for yourself. Let's see. Chastity says, 3 weeks postpartum, bled for the first week, started bleeding again, pretty heavy a few days ago. Is it normal? Smooth and easy delivery. Yeah. So the big picture question is like, when is too much when it comes to postpartum bleeding? And it can definitely go, it might not be much at first, then it gets heavy later, or vice versa. So in and of itself, what you've described sounds normal to me. And so the thing that I think I just kind of tell everybody is, well, how do you know when it's too much? So at any point after having the baby, if you are going through a couple of like big time pads, like the big pads they gave you when you had the baby, if you're going through a couple of those an hour for more than a couple of hours and it's not slowing down, that ain't normal. So that's when you need to get checked out. If it's less than that, it's okay to wait and see. If it's persistent heavy, but not as heavy as what I'm describing, which is like go to the emergency room heavy, but just kind of annoyingly heavy, it's worth taking a look with an ultrasound. Every now and then you'll have somebody who bleeds randomly and weirdly, and so the overall trend should be it gets less and less as you go. So the further away from delivery, the less bleeding there is, and then eventually it stops. But that whole process could take 6 weeks. But so if you're sitting there like 8-9 weeks down the road, and you're just still having random bleeding, there's always a small chance of a little retained placental tissue. It definitely can cause irregular bleeding. You can almost always see it on an ultrasound. So if you were bleeding like that at that point, or if you were bleeding like I described, the go to the emergency room type bleeding, then you think, well, probably some retained placenta. So that's something to think about. Dee Dee's telling me. I got 3 questions over here on YouTube. Let me see. Okay. I see two more. Three miscarriages back to back. Should I stop taking Clomid? No, not necessarily. I mean, it's helping you get pregnant. You're just not staying pregnant. So I think it's more about getting an evaluation of recurrent miscarriage. And there is a video on my YouTube channel that talks about that, so I would check that out. Let's see. Island Girl Love says, 39, you have a 10-year-old, really want another kiddo. Here it goes. Should you keep trying or give up because of age? No, don't give up. Absolutely. You know, there's a video on my channel that says the title is 35 too old to get pregnant? I've mentioned it a couple times already, but the short answer is no, it's not too old. It kind of talks through some of the things that are specific to being 35 and older as it relates to getting pregnant. So maybe check that out. And good luck. I think I got all the questions done here on YouTube. If I didn't answer your question on YouTube, redo it. Copy it, paste it, please, because I think I got everything. Oh, no, there's one. Is flying long distance in the air concern for first trimester? No. It's fine. The main thing is at any point in pregnancy, long distance air travel, the risk is blood clots. So, you know, because you're pregnant, you're hypercoagulable. Because you're in an airplane, you're dehydrated, and you're sitting cramped up if you're like most people in a plane in these little bitty seats. And so that's just a setup for a blood clot. So the big thing, and when I say blood clot, I mean like in your legs, a deep venous thrombosis. So the main thing to know is that you should get up and move around every hour or two, really stretch your legs, walk up and down the aisles, go pee, and hydrate like crazy, because that'll reduce the dehydration risk. It'll make you get up to go pee, and that'll all in turn reduce your risk of blood clot. I also recommend to folks to wear support socks. There's not great evidence for that, but there's plenty of evidence in other situations that compression socks reduce your risk of venous thromboembolism. So I would do that as well. But beyond that, there's no problem. And there's a video on my channel about that too, about travel. Genesis, what are your honest thoughts on trying to conceive a tubal reversal? Yeah, it's fine. You know, I mean, the main risk from tubal reversal is that it either doesn't work because the tubes just weren't recannulated, or because you have a higher risk of tubal pregnancy because same thing. So your tubes have been messed with and they might just not have a clear passage. And so you might have a higher risk of an ectopic pregnancy. But I mean, aside from those things, no, I mean, I don't keep trying. I just think you probably need an evaluation for recurrent miscarriage. Let's see. Heather, is having a period while on the mini pill common? Actually, flip side. So not having a period on the mini pill is the most common thing. But to have some irregular bleeding on a mini pill is real common. Not many folks are going to have a regular period because the mini pill is continuously dosed, so there's no break. Every day you're taking some progesterone, there's never a break. So you shouldn't have a regularly scheduled period on a mini pill, but some people do just have random bleeding. And that's more to do with the fact that just progesterone may not completely suppress your period. Yeah. You asked me a yes or no question, I gave you yes or no. I don't think I have anything else smart to say about that. I felt like I did, but I guess that was it. All right, let's see. Yeah, let me know when you get pregnant there. So I'm just curious because some of you guys jumped on afterwards. I just had somebody from South Africa on YouTube. That's insane. So where are you guys watching from, Genesis and Island Girl? I'm just curious. I'm just amazed at how far these channels reach for just my little YouTube channel. Let's see, Brooklyn. You've had 2 miscarriages back to back, wondering if something might be going on, or should you have another miscarriage too? No. So I recommend after 2 miscarriages have an evaluation. I've been talking about that a lot today. There is a video on my YouTube channel that is called Evaluation of Recurrent Miscarriage. It's under the infertility / trying to conceive playlist on my YouTube channel. So go watch it, and those are the things I'd recommend you do. And you live in Italy. Holy cow, I'm going back and forth. So where in Italy? I've been to Italy. I love Italy. It's an amazing country. We were in the Dolomites. We were in Venice just about 3 years ago. The Dolomites were amazing. We were there in Cortina in July, first day in July. And we were supposed to go rock climbing on the Via Ferrata, and it snowed like 20 centimeters, so that we didn't get to go rock climbing. But we went for a hike, and it was nice, but it was snowy. So yeah, I love the Dolomites. And Venice was amazing for a day or two, but the Dolomites were better. So where else should we go in Italy? Let me know. Let's see, Monica, currently 17 weeks pregnant, previous miscarriage, and ectopic. Some days anxiety is higher. What do you recommend for anxiety? That is minor some days. Um, I guess two things. One is that, I mean, obviously you're well beyond those bad things that happened previously, and easy for me to say, but from that perspective, you're in a lot better position now than you were in the first trimester. So I'd be a heck of a lot less worried now at 17 weeks than I would have been like right around when you first got pregnant. So more of the generic, like, well, what do you recommend for anxiety? I recommend doing anything that's not pharmacologic for starters. So, and you just got to find your own groove. So, for me, I always joke, but I'm totally serious that exercise is my Prozac. So for me, if I'm anxious, I go for a long run or bike ride and I feel better. So for me, physical activity really helps. For some people, it's meditation or it's a hobby that they do that they enjoy. But it's just whatever it is that can, help you take your mind off the things that are making you anxious. So that's my recommendation. If it's more than you need to start talking about medications, then that's worth a visit to the office to talk about in some detail. Let's see. Okay, so in Turin. Oh yeah, we went to where the heck were we? Where the Iceman Bolzano, what's his name? Utsi. We were there too, which I think is kind of north. It's an amazing country. It's beautiful, and people were really, really nice. We had a great time there. I'd love to go back. That Utsi thing was pretty cool. They found this. If you don't know, what I'm talking about. It's like they found this dude buried in the ice from, I forget how many thousand years ago, a long time in the past, and he was pretty amazingly preserved because he was in this glacial ice for all these years, and so there wasn't a whole lot of deterioration of his body. And they have this thing in this town called Bolzano where you can go, and it's basically a museum where you can see his body. It's behind like tons of security and glass, and you can't really see it. The window's like that big, but still pretty cool. And you can see like the things that he had on him. He had like an arrow and a bag of arrowheads, and they could tell what he had for dinner before he died. It was crazy. It's pretty amazing. Sorry, I digress. Brooklyn, how long after tonsil surgery should you wait before trying? I think as soon as your ENT says you're all healed up and recovered from surgery, go for it. I don't know a whole ton about tonsils other than that, but as soon as your ENT says you're healed, you're good to go. No need to delay. Okay, let's see. How about 43? Crazy? Question mark. Besides genetic risks, right, with cell-free DNA, you can pick up on it. Is there high risk for helping them? Little higher risk for preeclampsia. Little higher risk for preterm birth just kind of in general. But if you're an otherwise healthy person, if you can get pregnant and everything's okay with the baby, with the chromosomal stuff, then an otherwise healthy 43-year-old, it's not that big of a deal. It's just more about all the other stuff. So it's the chromosomal risk and the miscarriage risk and the decline in fertility. But if you get through those hurdles and you're pregnant and everything's okay, should be fine. I've taken care of 40-something-year-olds. My dog is ringing the bell, which is his sign for he wants to go outside. Let's see. So yeah, then Didi was talking about magnesium citrate or Epsom salt baths. Yeah, those are nice calming ways. Lavender, some people like that. So any of those things I think are fine. I just try to stay away from pharmaceuticals whenever possible, just because those things act in your brain. We don't know what they do to babies. And you're probably better off not taking them if you can help it. Nina throughout Switzerland. Is it you're watching from Switzerland? Is that what you're saying? Holy cow. That's awesome if that's true. I'm going international today. It's amazing. Pretty cool. All right. Well, I'll give you guys a couple more minutes. There's still a couple questions trickling in. Still a couple people watching on Facebook as well as YouTube. So if you're out there and you have a question, hit me up here in the last minute or two. Otherwise, we'll wrap it up for today. While you're still here, thanks to everybody who's watched and is watching and who's put in comments and asks questions. And there's people who show up every time, like Didi is amazing. So thanks to you guys, because I'd be sitting here with absolutely nothing to talk about if you didn't put comments in the chat. So thank you. I really enjoy doing this. I do it like most Fridays around this time, usually around 2 o'clock Mountain Time. I don't know what time it is in Switzerland right now or Italy, probably close to 10 p.m. Am I right? It's about 8 hours ahead. maybe it's 11 p.m. there. I don't know if you guys do daylight savings time or not. That always confuses me. Um, so yeah, so that's a long-winded way of saying thank you to everyone who's watching and has watched and has commented. Try to catch you again next week. Next Friday should be good. I think the Friday after that, I think we have parent-teacher conferences. I can't remember. But anyway, about every Friday or every other or so around this time, you'll see me on here. So if you missed your question, you can put it in the comments of like the YouTube video, because I'll still see that after the fact. If you have a question that I didn't get to on Facebook that I missed, you can retype it, just copy and paste it to the video post, because I'll see the latest comments first, I think. And so if I see it after the fact and I missed it, I'll try to either answer it next time, or sometimes they're really good questions, I'll just make a video. So just keep that in mind if I've missed your question today. So thanks to everybody who's been watching. Thanks for all the way from Italy. That's amazing. So thanks to everybody who's been watching. It's been super fun. I think we'll call it good for today, because I'm not really seeing any more questions pop up and I'm just babbling. Have a good weekend. Ironman Kona tomorrow, to anybody who cares. I'll be watching that on Facebook Live, starting at like 6:30 in the morning Hawaiian time, which is like 10:30 here. So it's the Ironman World Championships tomorrow. I will never get to participate in that, but I will always watch it because those people are amazing. All right, have a good weekend. Thanks for everybody for watching. Thanks, Dee Dee. Catch you guys next time. Peace out.